Hello, my name's Katie Willoughby. I'm going to be talking about some basic concepts of pathophysiology, and I'll start with disease. Disease is defined as an acute or chronic illness which causes physiologic dysfunction, and it has specific signs and symptoms. Disease can be classified in many different ways, such as bodily systems like respiratory disease. It can be classified anatomically, such as heart or lung disease. It can also be classified as a physiologic disorder like metabolic, or it can be even classified by its etiology. Etiology is the cause of a disease. So an example of etiologic classification would be Neisseria gonorrhea, which is the bacteria that causes gonorrhea. There's also biologic etiologies, other biologic etiologies like bacteria, viruses, prions. There can be physical etiologies like trauma or burns. Chemicals are another type of etiology, such as poisons or alcohol. And another cause of disease would be genetic abnormalities or metabolic imbalances, such as too much or too little. The next concept I'll be talking about is pathogenesis. And pathogenesis is how a disease evolves from the time of infection to the time of the presentation of the disease. So an example of a pathogenesis would be for Shigella. And so a Shigella strain enters the body. It attaches to intestinal cells and enters the intestinal cells. And that causes inflammation, cell death, and sloughing of the intestinal lining. And all of that's pathogenesis, and then it presents as diarrhea with or without blood. The next concept I'll discuss is signs and symptoms. These are the manifestations of an altered physiologic state. Symptoms are subjective, so to say I hurt or I have chills are subjective, so those would be considered symptoms. Signs are objective and can be measured. So if I hurt, a doctor may be able to see redness or edema. And if they have chills, the doctor may suspect a fever, and they can see that by taking a temperature. So a high temperature, like 101, would be a sign. And a syndrome is the combination of signs and symptoms that present as a specific disease state. So an example of that would be Cushing's syndrome, and that one is presents as like abdominal obesity and also changes in mood. They have very specific signs and symptoms that make up Cushing's syndrome. The next point I'll talk about is diagnosis. Diagnosis is the designation of the cause of a disease. And to diagnose, you'll consider competing possibilities and selecting the most likely to be the cause. Diagnosis can be affirmed by diagnostic media. That includes things like x-rays, blood tests, cultures. So if the diagnosis was presumptively a fracture, that can be confirmed with x-rays or radiographs. Next, I'll discuss complications of a disease, and these are additional diseases that complicate the healing or treatment of the original disease. So a complication could be an infection of a surgery site. And then prognosis. Prognosis is the anticipated course of the disease without treatment, as in life expectancy, morbidity, or mortality. such as the prognosis of a dog diagnosed with osteosarcoma is likely metastasis to the lungs and likely death within 3 to 6 months of diagnosis. Thank you.